This is Chris Kelly with LakelandLocal.com, which is just a few tips and techniques for assessing your abdominal training routine. Now, one of the most common issues we see with people that have stopped achieving progress with abdominal training is a lack of mobility in areas that we're trying to train. Generally, we get a shortening of the obliques, of the muscles of the back, of the hips, really the areas that we're trying to work with abdominal training. And as a result, we can't tone these muscles or engage these muscles effectively. With that in mind, one of the first orders of business is to check these areas for range of motion periodically in order to kind of get a baseline of whether or not the kind of effect our training is having. All right. With that in mind, kind of the key tests that we like to utilize for this, would be number one, breathing. Okay, for breathing, what we're going to do, you just place your hands on your ribs. All right, what I want you to do is take a deep breath in through the nose and release through the mouth. Take a deep breath through the nose, release through the mouth. You're going to do a few cycles with the hands on the ribs. We're going to perform a few cycles with the hands on the front and the back here. And what we're looking for is whether or not we're expanding through the belly, meaning coming forward, in the case of forward and back, and out, or if we're breathing up with the shoulders. Oftentimes what happens when these muscles around the stomach are restricted is we fall into this upper chest breathing pattern. And what this helps us to do is kind of figure out whether or not we're getting motion from here or here. All right, if these areas are restricted, for example, if the lateral structures here is restricted, we know that we have a restriction here in both the rectus abdominis, or the kind of the front here, and the obliques. All right, so what we want to do to take care of that is incorporate a release technique. Okay, what we're going to start out with here is just a simple tennis ball. All right, what I'm going to do is place the ball down here on the floor, place it under my external oblique, so right about here, this area, and I'm just looking for any tightness or soreness. I'm finding that area here. And I just want to relax and let this sink in. I'm just taking deep breaths with this, just letting my belly expand, holding for about a minute at a time. All right, by the same token, I'm just going to hit the other side. Again, just relax, let it kind of just think about letting it sink into the stomach, let it release that area. Okay, and then we're going to finish up there, then we're going to release it with a stretch. All right, so we've kind of gotten the trigger points out of that area. Now we just want to lengthen it. All right, a really good stretch to do that is just hanging over the ball. All right, because I'm just releasing this area, I'm taking deep breaths, I'm relaxing into the stretch. I'm just holding for about 60 seconds. And I would perform that either before abdominal training or several times a week. Now, by the same token, if we find that our back is excessively arched while we're breathing, or we're not able to really feel expansion in this area, we have a restriction here in what is called the erector spinae, the muscles of the back. All right, what we're going to do to release that area is we're going to take this is what we call peanut. All right, what this is two tennis balls that are taped together. This is about a $2 investment right here, but it's a really good tool. We're going to place it behind the muscles of the low back right here, right, actually about the mid-back. All right, I'm just going to lay over it. And the same rules apply. I'm just going to lie on this thing here, perform just several slight oscillations, and then relax into this vertebrae. I'm going to hold for about 20 seconds, move up a little bit, relax into it, just let it kind of sink in, do a couple oscillations, move up again, until I get to the base of my shoulders. Generally, you're going to find one or two segments of the spine that are restricted. You'll hear some cracking and popping as they release. From here, what we can do is just incorporate a slow stretch of this area. And in order to do so, all right, what we're going to do is just lean forward like this, just getting a flexion stretch. I'm feeling kind of my back release, and just hold for around 60 seconds. Really, those two things combined, I find, get the best result, especially if you're not really sure which areas are restricted. You just know that you're not breathing as well as possible. The chest is rising. But incorporating those exercises before your abdominal workout or several times during the week, and periodically checking your range of motion is a great way to help to just kind of assess your routine and keep progressing forward.